Hormone therapy and lipids and cholesterol. We're going to talk a little bit more about that. I've done a few videos on this in the past, but we're going to do a few more study reviews here. Hey guys, it's Dr. Eric, the fitness physician. We're going to talk about hormonal fitness and cellular muscle medicine. So HRT or hormone therapy and lipids. So cholesterol, looking at all, I do more of a deep dive into all your lipids, way beyond typical. We look at the cholesterol markers of HDL, LDL, triglycerides. We look above and beyond that. Do an advanced lipid profile, looking at the size of the particles, the number of the particles, and so much more. So again, this is based on not only clinical studies, but scientific journal articles and reviews. There's a journal in the Journal of Atherosclerosis. This is a very big, well-randomized study with men, and they've studied women as well, but this one is specifically men. And it showed basically, again, the bottom line with higher and more optimal levels of DHEA, SHBG, and estradiol, and of course testosterone. But this is more looking at these three. They had improved lipid and glucose metabolism. And what that means is your cholesterol, all your fat molecules, your blood sugar was metabolized properly, right? And that's what I'm all about, cellular medicine, getting the pathways moving properly. You should have the proper metabolism when you eat food, fat, sugar, etc. It should be broken down, metabolized properly without excessive waste products, and it should go down the proper pathways. When you don't, and when those cellular pathways are broken, or you're eating the wrong foods, or the wrong foods at the wrong times, or any food too much of at the wrong time, it can lead to abnormal problems with your blood sugar and your lipids, right? And then that's going to cause problems. And then what this study found was not only that, but if your hormone levels are optimized, this is going to help this as well. They found when you had optimal level of DHEA, SHBG, and testosterone and estradiol specifically, you get increased HDL, which is what you want. You had decreased LDL, and it decreased, more importantly, like I was talking about, those more specific fractions or subfractions of the LDL was oxidized LDL was down, which is very important because LDL in itself is actually good. Most people are demonizing LDL cholesterol and just overall cholesterol lowering way too much, and that's becoming a problem. But you actually want to be optimal a little bit on the higher side, believe it or not. But when it gets oxidized, that's what you don't want. It's oxidized because, again, of too much food, inflammation in the body, poor lifestyle, suboptimal hormones, much more. Also, the ApoB and the triglycerides were decreased again, which is a good thing. ApoB is that little protein molecule that sits on top of the cholesterol molecule, and there can be multiple of those. And that's a better proxy, better marker of your cholesterol than looking at LDL or just total cholesterol, right? As is particle size, and I'll get into that later. Triglycerides, of course, are also, I see that a lot when those are elevated. Usually, it's an early sign of a fatty liver, usually from a sign of insulin resistance, more than anything, which, as we all know, is a huge problem here in America and in the world, right? So these were improved, right? Again, another thing was decreased was monocyte attraction to the vessels. What happens is, again, cholesterol is a good thing, but when there's inflammation or insulin resistance, etc., and then there's damage to the vessel wall, the lining the vessels in your heart and your arteries and everywhere in your body's going to try to heal that, right? That's why cholesterol goes in there to kind of patch it up. It's kind of like that mortar to patch up a crack. But monocytes come in first, and they get converted into macrophages, and then they will seal it up. That process is unabated because of the continued bad food, lifestyle choices, inflammation, toxins, etc. They become more inflamed, and then they release inflammatory markers, and they attract more of these, right? More monocytes, and then eventually you get an overload, then you get too much stuff coming in there, and then you start to get a plaque, and that's what you don't want. So, but we can reduce this attraction to these vessels with optimal levels of hormone therapy, in addition to reducing that insulin resistance, reducing that inflammation in general, reducing that oxidation. And this is what happens. And again, the most important of these was SHBG and estradiol. Studies have shown clearly when these levels are optimal, you decrease risk of cancer, cardiovascular disease, and so much more. That's why I see so many, and I still hear on podcasts, I read on blogs about, the bros out there, even physicians talking about, you want that low. Lower that SHBG because it's binding up all your testosterone, right? You got to lower that. No, that's not what you want. This is still active when it's bound to this testosterone. And again, number two, when the SHBG is elevated, it's protecting you against cardiovascular disease and cancer, the two top killers of men and women everywhere in the country. So you want that to be optimal. You don't want that lower. That's not doing anything for you. It's increasing risk. And again, in this study, the punchline here is that the opposite of all this happened when estrogen was blocked. So again, still hearing about an astrozole putting the guys on estrogen blockers. Bro, you gotta get your estrogen down. Bro, you gotta lower your estrogen. You're converting all your testosterone into estrogen. Well, you do that and you're reversing all this. You're blocking this. The number one killer of men and women, heart disease. So if you want to prevent that, you need to optimize estradiol. You do not block estrogen or estradiol. It's still out there. People are coming around and starting to see other people talk about this more and more. But again, if you block this, you're going to increase the risk of cardiovascular disease. You're going to increase the risk of osteoporosis, of visceral fat accumulation, and sexual dysfunction. So guys, if you want a limp, a big fat gut and thin bones and heart disease, block your estrogen. That's all I'm going to say. The studies clearly show us it's hands down at this point. There's no arguing that. So anyway, so that was the punchline here is optimizing your lipid. To optimize lipids, you want to optimize your hormones, especially DHEAs, HPG, and estradiol. Men, again, you're going to do this through testosterone optimization and not blocking it. Women are going to take estradiol, and I'll talk about later more about how to do that too. So anyway, I hope you liked this post. Please like and share it. And again, I'm doing telemedicine all across the country. Some new programs, new products coming out soon, so stay tuned. If you want to get my free newsletter or jump on board and get a free discovery call with me, please DM me below and let me know. Everyone have a good day. Remember to live to give. Do something nice for someone today and pass it forward. Everybody have an awesome day. We'll talk to you soon.